Good morning. Looks like we have a few more board members to come on board before we're ready to start. Just for your information, I received a call from Carrie Severson, who said that he'll be a little bit late. And I think he let Ingrid know. I believe Ingrid's our co-chair.
You're frozen. Hi, Tracy. Can you hear me?
Yes, I can.
Okay. I'm sorry I'm running late. I have to come right from the school, so it's a bit of a time crunch. Carrie messaged me and said there was something going on at the farm, so he's going to try to get here, but I may have to start the meeting before he gets here.
Okay. Looks like we have Carrie.
And I'm going to be right back.
Okay.
I see Megan's on the phone too, Tracy. I know there's probably some issues because there was a password for some people this time. So I'm guessing she's helping whoever is on the phone call.
That did not get put on our website this time around. I sent it out, but yeah, we'll see. It looks like Carrie is here. So we've got Carrie, Dr. Barris, Cindy, welcome, and Ingrid. So with that, we probably have a quorum, correct? We need 4 for a quorum. But I know Ingrid had to step away for a second, so I think she'll be right back.
And technically, isn't Carrie in Alaska, it looks like?
So Tracy, do you know if we have a quorum?
Yes, it does look like we do, and I see that Carrie is on as well. So
Oh, good.
I think we have 4 of you, and Angie just mentioned that Megan's on the phone, probably talking through a couple of people getting logged in. I don't think the password was apparent to everybody.
I'm on the phone with Deb. She's having some other technical difficulties.
Okay.
It's not regarding the password, so I'm just trying to help her through that. So.
But I think it's up to the board if you want to start or if you want to wait.
Oh, there's Carrie. Hi, Carrie. Glad you made it.
Hello. Has anybody heard from Van and Brad?
I have not received anything from them.
Well, if we got a quorum, then we're gonna go ahead and get started. So I'm gonna call this meeting to order from Health and Human Services. I would entertain a motion to approve our 16-point agenda.
I can make that motion.
We got a motion by Ingrid. Is there a second?
Second.
Seconded by Dr. Barris. All those in favor signify by saying aye.
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 Aye. Opposed? Motion carried. Was the meeting properly posted?
Yes.
Wonderful. So we'll move on to citizen comments. Is there any citizen comments? Do we have any citizen comments? See any citizens on here? Any board members or staff have anything to comment on? Hearing none, we'll move on to agenda item number 4, the director's report. Tracy?
Thank you. All right, well, I'll share a little bit about the our different programs and go into kind of a broader report on the agency. With economic support, in order to continue to support those who are in need during the pandemic, recipient eligibility for Badger Care and Medicaid has been extended to January 21st. Cases may only be closed if recipients move out of the state, pass away, or request to end benefits. Also, food share renewals that were due in October, November, December have now been extended to next April, May, and June. Supplemental food share will again be available to households for November. As of the end of October, the Wisconsin Home Energy Assistance Program has assisted 431 households and paid out over $261,000 in benefits. This is a slight increase from the same time last year. We also have access to Keep Wisconsin Warm funding that was provided through the CARES Act. These funds can be utilized to assist households to catch up on arrearages rather than drawing upon the other crisis funding that the county receives. And although it's not administered through our office, there's additional unemployment assistance that became available when Wisconsin received funding to provide lost wages assistance of $300 a week to eligible individuals who are unemployed due to COVID-19. This payment is issued through the unemployment office. With Child and Youth Services, we mentioned this last month, the number of abuse and neglect reports continues to be high. Our Child and Youth Services staff follow up on each of these reports and determine the appropriate response. When cases do not require formal interventions, Child and Youth Services staff offer voluntary services and supports to families in order to address their needs. Some families have declined services due to COVID, however, as they are limiting contact with people outside of their circle. Behavioral Health Services recently had a very successful site visit for the Coordinated Services Team initiative. Coordinated Services teams use wraparound services to support families with children who are coping with emotional difficulties and are involved in 2 or more systems of care. This site visit was conducted virtually by a Department of Health Services surveyor who reviewed our program's progress toward goals and compliance with state standards. The site surveyor was very complimentary of our program. Behavioral Health Services are in the final phase of trauma-informed cognitive behavioral therapy training, or TFCBT. This is an evidence-based treatment approach for youth who have experienced significant trauma. Having staff with this specialized training will greatly benefit children in our community who have been trauma victims and are in need of treatment. Our crisis staff have been increasing awareness of available community crisis services and crisis diversion services to our law enforcement and other community stakeholders in order to utilize alternatives to inpatient hospitalization when it's appropriate. The ADRC's virtual caregiver boot camp started last week. There are a total of 29 people signed up for the 5-week program. This is a free educational program series for families affected by Alzheimer's disease and other dementias. Sessions are held via Zoom every Monday in November from 1 to 3 o'clock. Each week highlights a different topic. Interested individuals can still sign up for the remaining sessions. The ADRC is ordering caregiver library kits, which include educational materials related to caregiving and also activities to do with care recipients. one kit was distributed to the Viola Library in 2019, and this year the kits will be distributed to the Brewer and Lone Rock libraries. The ADRC continues to participate in local work group that is bringing Project Lifesaver to Richland County. The ADRC will be the informal clearinghouse for the program and forward referrals to the Sheriff's Department, where individuals can be fitted with the GPS transmitter. The Sheriff's Department will then be responsible for administering the program and doing monthly check-ins with those who are utilizing it. For the agency, I guess I just want to share that all of our staff have continuously gone above and beyond in so many ways during this public health emergency. One of the most recent examples to share is the staff from our administration, business, and economic support units have volunteered to set aside some of their regular duties to assist with the free community testing event every Monday. We have staff helping with the community, the flu clinics, the community testing, and emergency operations activities. With all this, as well as continuing to provide services in new and challenging ways, and at times with great risk to their own health and safety, our staff have all stepped up to meet the needs of our community. They are to be commended for their dedication during this public health crisis. Rose will talk about the status of the pandemic, but I'd like to share that we are doing what we're doing here in the agency as we see the number of COVID cases increasing exponentially. I've added a data sheet in your iPad folders that shows the current status of the COVID-19 cases in Richland County. We're continuing to provide services by virtual means as much as possible and only in person when necessary. Extra safeguards have been put into place for any walk-in clients in order to reduce the risk of exposure. We have ceased all in-person meetings between staff in the office. We've increased remote work options for staff where possible. And in some units, staff teams are alternating days in the office in order to mitigate the risk of an exposure to the whole unit. Staff continue to rotate working remotely and in the office. We currently have 47 of our 65 regular Health and Human Services staff working remotely in some form. 11 are remote full-time and 36 work remotely at least one day a week. Over the last month, 3 of our staff have needed to be in isolation because of testing positive for COVID. 6 have had to quarantine because of an exposure, and 6 staff have had to miss work while awaiting test results. As COVID-19 continues to surge across the state, Governor Evers announced an executive order number 94, which advises Wisconsinites to stay home, urges precautions that Wisconsinites should take to stay safe if they have to leave their home, and encourages businesses to take additional steps to protect workers, customers, and surrounding community. We are continuously assessing whether we should close the building to the public again due to the critically high case activity in our county. We will be holding an emergency management meeting this afternoon to consider this once again. And that's all I have for my report. Are there any questions?
All right. We're gonna, actually, first off, I'd like to welcome Cindy Chicker. Hi, Cindy. Cindy just joined our committee, so this is be her first meeting, I believe. You want to say anything, Cindy?
Let me unmute myself and say thank you for having me. I guess I will hope to learn a lot about the more inner workings of the HHS department, and hopefully we'll be able to add whatever knowledge or expertise I have to that, to you anyway. Thank you. Thanks.
Thank you for being here with us, Cindy. All right, we'll move on to agenda item number 5. Rose, you have a health officer's report for us today?
Yes. As Tracy mentioned, again, the exponential increases in positive COVID tests here in Richland County has definitely created a burden for public health. We are continuing to enhance our staffing, and I'm hopeful that with the addition of a 32-hour position, that'll help to offload some of the burden that some of the nursing staff and some of our other public health assistants are experiencing at this time. All I can say is I know we've been talking about this for 8 months, if not more, and I can only advise that folks adhere as closely as they possibly can to the governor's emergency order, and to just really reach down inside yourself. For those who are marginal or questioning whether or not preventive measures are such that they would want to, engage in that, I would have them take a look at who they want to keep safe, whether it be themselves, their families, if they want to keep our economy safe, whatever motivates folks. But I would firmly, encourage folks to do what they can to engage in preventive measures to keep our community safe, but also to keep our hospital up and running so that it doesn't get overwhelmed. We hear more and more in the media regarding the fact that some health systems are becoming overwhelmed with the numbers of individuals who are in ICUs and or on med-surg units, and finding places for folks upon discharge is a difficult task as well, because every healthcare system appears to be experiencing either shortages on staffing, or there's the difficulty with bringing someone who may be COVID positive into an environment. So lots occurring right now. Of course, the possible advent of a vaccine causes us to be hopeful, but there are an awful lot of intricate details associated with that particular product. If I just look at the Pfizer product, there's an awful lot that would have to occur to be able to safely provide that vaccine to the general population here, even in Richland County, as small as we are. So lots of moving parts occurring at this time, and we're keeping a very close eye on everything while we're trying to just appropriately manage everything that we're seeing from day to day. And I appreciate the support. I appreciate the support. I can't say it more.
All right, does anybody have any questions for Rose? Okay. Well, we'll move right on to our next item then. Agenda item number 6 is review and approve Health and Human Services vouchers. Now this would be on your tablets down at the bottom. Cindy, I'm not sure how you receive your packet. Was Cindy given all the information that she needed for the meeting?
I believe so.
Okay.
Yep, she's shaking her head, yes.
It would help if I would unmute. So yes, I did receive it and have a chance to look at it.
Awesome. So Angie, are you giving this in lieu of Robin's absence?
Yes, I am.
All righty.
All right, so if we want to go to, actually, I didn't pull out the original. Here, I got my original paper. So if you want to scroll, Tracy, to the first few, Cindy, to let you know, the first few vouchers are all mileage expenses that are largely based on the ADRC and transportation that rides that people are offering. So that goes through page 2. So page 3, there we go. It says vouchers. This is where it starts the actual bills. Sorry, I got a mess here. Invoices that are paid. These do not include, Tracy, and you can help me here. This does not include most or any client specific payments. So you won't see any names related to specific clients. These are more administrative bills. Oh. I think someone's just getting on. Okay, so then
I believe that's Debbie, and she was having some technical difficulty with her iPad, so she's joining us by phone, I believe.
so on page 3, I did want to point out, actually, no, page 4, sorry. There was nothing strange on page 3. I just really go through, Cindy, and point out what are larger charges that might need to be clarified a little bit more.
Mhm.
So actually on page 3, I'm sorry, page 3 is that card member service. To clarify what that is, that's actually our agency credit card. So there are a variety of things that come up throughout the month that we have to charge, maybe online to get it fast enough, or it's just the only way that the vendor will accept payment is via a credit card. So item number 2, if you see it right in the middle, through item number 10. 2 through 10 are all those card member charges. They're kind of out of sequence there with their numbering, but that's card member, that would be credit card. The only one I was going to point out is number 8, which is actually third from the top. And that is one we always point out every month, and that is our Cario bills. So it's our behavioral health electronic medical records system. Every month, they accept payment through our credit cards. So that gets charged. That is also with a voucher number 9. The 2 of those added together, they're just 2 different funding sources. If you see right in the middle, Fund 56 point, let's see if Tracy, there she got it. There are 2 different funding sources that are broken down, but the total amount is what we add together for that electronic medical records system cost. So that's always on our agency credit card bill every month. Otherwise, if you go down to Tracy number 6, you see that vendor total, $2,310.60. That's the total of all of the card member services, all the credit card bills added up is that $2,310.60. That's all I wanted to point out on page 3. If you go to page 4, just a few up from the bottom is a large one, number 18, Fruit Broadcasting. If you see that says advertising for $3,750. That is actually public health, has a state opioid response grant, and those grant funds were used to secure radio spots on WRCO. I believe they were 60-second pre-recorded regarding underage drinking. And I actually heard them a few times listening to WRCO. So those ran 9/19. These are charged from 9/19 to 9/30. So the month of September, and I'm guessing maybe there's some ongoing bills coming as well. But for $3,750, that's what that's about. Then if you go to page 5, down at the bottom starts with number 24. If you see it in the Quill Corporation. It's again another running vendor totals with different account codes that Quill Corporation charges are put towards, and those are our office supplies and our janitorial supplies as well. So cleaning and office supplies is largely what that makes up. It does carry over into page 6. Tracy, if you want to go there, and that's where it continues. Then 7, page, it's all on that page too. Yep, and then page 7. And you'll see right at the top then where it does that vendor total, $1,381. Also included in there is a large purchase of toilet paper that I did just to get all that in before winter. And before there's a shortage again, maybe. And then there was, now everyone's going to rush out and buy toilet paper. There's no shortage. I actually do this almost every year just to stock up. Then also in there are 2021 calendars for staff. So we had to order about 50 different varieties of calendars, desk calendars, and planners for staff. So that's all in that as well. Then if you go to page 6, no, I'm sorry, 7. I didn't turn my pages. Sorry, Tracy, when you were turning your pages. Sorry. So I am on the Santa pasture. There he is. Page 7, right down at the bottom is the vaccines starts, the public health. So you'll see, I'm assuming, Rose, you got a big credit because they didn't send you stuff last month or something. You're on mute.
I believe our credit probably came back from vaccines that we returned from last season.
Oh, wonderful. So, and then there were new charges of vaccines.
Right.
So that's what is there, the total $2,221 for that. And then if you go to shopping news, I noticed was some different bills on page 8, 63, 64, and then 49. That was kind of a large shopping news bill, I thought. And when I looked it up, because usually we do advertising through that for vacant positions, which I hadn't been doing for a while. So what this is ADRC did some advertising for voter transportation and virtual caregivers. And then Public Health also did some advertising for the drug take back day using STR or state targeted response to opioids grant funding. So all of those were actually have funding sources used. And the last one for this section I had was page number 65. Sorry, turn mine, which is on page 9. I did not know who Wolf's Grant Land graphic was. And when I looked that up, even though it's not very much, I just wasn't quite sure to make sure this was accurate. And it is the ADRC purchased some low vision calendars for 2021. Those are 15 total calendars. So I didn't notice much with those vouchers that were concerning. There's a lot of previously paid vouchers, which I just wanted to point out. What I was noticing in these is there's, if you remember, our October meeting was quite early. It was like the 8th or something like that. So there are a lot of vouchers. If you look down in the description, there's a number of September bills that we didn't get paid in October because our meeting was so early that now we're trying to pay for them. They prepaid them so that they wouldn't be late. So you'll see the Richland County Food Service and St. Anthony School had some September meals. Those were some of the larger dollar amount items on this. Otherwise, most cases, we prepay stuff just to not get charged any sort of interest. So that's what like Quick Trip and things like that you'll see. If you look also then below voucher number 9, 10 through roughly 16, there's one in there that's not, they're all COVID related. And the reason we had to do that is to tap into routes to recovery funding. We had to get these on the books paid that we processed through so that by last Friday, we were able to submit these towards that funding. And a lot of the larger dollar amount ones in there, you'll see JComp Technologies for $6,712. Those were laptops. And these were all things that were brought before you as a board previously, either for emergency purchasing or just preparing to go virtual. You'll see JComp Technologies on there a little bit, a number of times. Anytime you see them, that is what they are. They do all of our laptops and things like that. So that's all I had. Any questions for me?
All right, and you're looking for approval for our vouchers, correct?
Yes, and then I will do that same email that I did last month. I don't have it prepped right now, so it might be a little bit after the meeting before I actually get those off to you guys, but I'll be sending those off so then you can respond that you authorize it, and I'll get that over to get those paid.
All righty, so in lieu of us not meeting in person and signing the document, Angie will email us a email. We just have to say your name and you approve of the vouchers for the October meeting. That's how Victor can kind of track that we approve those to be able to be paid then. So right now, a motion would be appropriate to approve our vouchers that we have. Is anyone willing to make that?
I'll make a motion to approve the vouchers.
Motion by Dr. Barris. Is there a second?
I can second that.
All right, so we got a motion by Dr. Barris and seconded by Ingrid. Are there any further discussions on the vouchers? Hearing no discussion, all those in favor signify by saying aye.
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 Aye. Opposed? Motion carried. Cindy, are you familiar with everyone that's on this meeting, our Zoom meeting today?
Actually, everyone except Mr. Nelson.
Right. So Van
I
Van
think.
is a county board supervisor. He represents Buena Vista Township, part of Buena Vista, down by Gotham. So he's a board supervisory board member.
Okay.
Alrighty. Then we will move on to agenda item number 7. The preliminary 2019 post-audit budget. Is this a discussion piece regarding finance and personnel's move that they did, or?
Well, I was certainly going to inform you of that. I did take the documents that were presented at the Finance and Personnel Committee. There was a presentation on the county's audit. And so I put those into your iPad folders so you wouldn't have to search for them if you wanted to see them. The Health and Human Services ended the year with about $551,000 of 2019, which is highly unusual for us to end the year with that many, that high a level of remaining funds. Typically, we would ask that those funds get transferred into the placement funds in order to cover what doesn't get covered in there with what the county is able to put into those funds for expenses. And we did take that request to this board last month, as you may recall, and then on to the Finance and Personnel Committee at the November 3rd meeting. The committee declined to transfer those funds into the placement funds. Those were originally transferred from the Health and Human Services accounts into the general fund of the county. That always happens that way. And then the request has been to transfer those funds to the placement funds, which have historically been under budgeted. There was discussion at the Finance Committee about not doing that because their concern was that it kind of hides the need for those funds to be more properly budgeted for. And so it isn't that those funds might not still end up going to cover the costs of placements if we go over that $1 million amount that is put into those two placement funds, but it would take a separate action to do so. So I did want you to have those audit documents. It's quite an interesting read as far as trying to decipher all of the accounting language in there. And without Robin here, I'm not going to attempt to try to do that on my own. But the ending year for 2019 was $551,951.63. And that is the amount that transferred over to the county's general fund from the Health and Human Services accounts. And that's where it remains.
Mr. Chair, if I can ask a question.
Go ahead, Mr. Glassburner.
Tracy, where did you say you put those? I don't see them in the folder for this month's meeting.
You might have to refresh your folder. I put them into where all of your other documents are. They're labeled Richland County 2019 Audit One is a presentation, one is financial statements, and one is the required audit communications.
Would that be in this month's folder, in
Yeah.
the HHS folder, or in this month's folder?
It
Okay.
should be in November, your November 12th folder for.
I just synced mine right before the meeting and I'm still not seeing.
Okay. I can certainly email them out if that would be helpful. They're showing up in where I'm looking to see that they're there.
Does anyone else get them? Maybe it's just my iPad.
I got
Yeah, I
them.
received them.
You got them?
Yeah.
I did.
Okay, what is it labeled again? Maybe I'm not reading it
That's right.
correctly.
Richland County 2019, and then the rest of the title is, one is audit presentation, one is audit financial statements, and one is required audit communications.
Yeah, I don't have it. Maybe it's syncing again, so maybe they'll come in. So thank you. I'll maybe message you if I don't get them.
Yes, be glad to send them.
Oh, there they pulled in. My internet has been really slow.
Good.
Sorry about that.
Are there any questions about the 2019 post audit decisions? So I guess the county board would like us to overspend it in placement costs. I get why they did that. To a point, anyway. We'll move on. Number 8, 2020 Richland County placement reports.
All right, I'll share the screen. Hopefully you can see this in front of you is the placement report. You will see in our adult institutional and inpatient placements that we had fewer days in placement, but still a significantly high cost for placements, and that was because there were fewer reimbursements that we received, and the higher cost placements were at Winnebago. We did utilize some crisis stabilization services for one individual. So our total county expense for crisis stabilization this year to date is $41,876, and our total adult institutional and inpatient placement expenses is $688,712. I'm going to scroll down to the community placements for adults. We continue to have, well, I guess we have one less person in placement, 9 instead of 10 from the previous month in August. Just a reminder to everybody that we don't have our placement data for October yet for you, so we're always a little more than a month behind. So our adult residential placements totals $238,379. We started the year with $482,278 in the adult placement fund. We have expended a total of $968,968 through September in adult placements, and that leaves that fund $486,690 in the hole. So there are not enough funds in that Fund 54 or the adult placement. I'm going to scroll down to show you the children's placements. We have child institutional inpatient and detention placements. That has remained pretty steady for the year in terms of number of days of placement. We have a longer term detention placement of a youth. So the total expenses to the county through September is $185,492. I'm sorry, I said that backwards. That's child institutional placements is 185,492, and detention costs is 31,475. In terms of community placements, that's foster care and treatment foster care. For treatment foster care, including youth group homes, we have a total of 140,672. And for regular foster care placements, 19,891. We started the year in Fund 44, which is the Child Placement Fund, with 527,341, with a total of 377,530 in expenses through the end of September. That fund has 149,811 remaining. I'm going to switch over to just the document that shows our projections. So now you should be seeing just the comparison of monthly expenses for placements. The gray shows 2018 monthly expenses, the light blue shows 2019, and the dark blue shows 2020. So you can see the dark blue is showing that we have had a significantly higher placement year in terms of expenses. So we started the combined total of the adult and child placement funds started with 1,009,619,000 in that fund. Right now, if the expenses that we have through September continue to trend the same through the end of the year, we would end the year with 1,795,331. So that's our current projection for the end of the year. That would cause a shortfall of 785,712. So that's a very significant shortfall. That certainly is why we were asking to have that 551,000 transferred into the placement funds. I guess whether the county decides to do that now or wait until the year ends to see how that fund ends, I suppose financially it probably doesn't make a big difference. But this is a significant year for placement expenses for Health and Human Services.
Are there any questions on our placement? Okay. We will move on to agenda item number 9, which is the 2020 contract monitoring report. Angie?
Yeah, so we'll see that come up now. Wonderful. Okay, so things are trending pretty well for, we're looking at the month of September is where most bills have come through. So Cindy, this contract monitoring report is something I do every month that summarizes any expenditure we have or placement we have that's over $10,000. There's a lot of other contracts or agreements we have out there under $10,000. To kind of relate to, I know I've worked with you before at the hospital. So the hospital would be on here as we're tracking the trends of when we used you for therapies. Does that make sense? Cindy?
Perfect sense.
Yes.
Thank you.
Yes. Okay. So it's very similar to that for every other placement that we have or service that we're paying for. So how this is organized is based on the manager. So the second column is the manager, and they're organized based on that because it's largely based on what the same kind of unit that I'm monitoring. So page 1 will show everything. What I look for is on the far right is the percentage. Oh, sorry, chat message came up in front of my screen. Or is that your, Tracy?
Oh, I apologize.
Okay.
I brought that over my, so I just want to mention, so Debbie, just in case you're having any difficulty unmuting yourself, you would press *6 on your phone. I think Megan was trying to get a hold of you, and of course you're on the phone, so she can't call you.
I pressed 6. Do you hear me?
Yes, we can hear you now. Thanks, Debbie.
Okay. Okay.
So to pick up where I was at, the far right side is the percent utilized. That's what I'm looking at when I do contract monitoring. So with bills coming in through September, I'm looking for anything over 75% utilization for this calendar year. So right where that little chat message came up, right in the middle, Family and Children's Center, you'll see on the far right is 85% utilized. The reason I'm not concerned with that is because the bills we've received, we don't anticipate using them anymore this year. So that would trend through December and it should balance out just fine. That will be underutilized for the contract amount. So Cindy, do you need me to go through? So the columns are pretty self-explanatory. What the total dollar amount is we have a contract for, how much we've spent, what month we've invoiced through, and then where our balance is of what we still have left to spend. So I'll just point out as we go through these pages, anything over that 75% utilization as of the month of September. So that's the only one on page 1. Page 2, there everything is trending fine there. Page 3, everything is trending well there also. Know that the contracts that we just paged through that are trending well are largely managed by Lori Cooey, who is the Birth to 3 program or Children's Long-Term Support. And a lot of those funds simply pass through us. So it takes some time to actually trend and track where they're at, but largely they're going to be well under the contract amount of 11,000, which is usually what Lori's looking for in order to get specific contract language included. I'm getting an echo, sorry, that's really strange. Okay, so page 3, I don't see anything else I need to point out there. Page 4, 2 up from the bottom is Cario, and that's at 78.96% utilization. Cario has billed through October though, if you see that. So we are trending just fine because we are looking for just September bills. So they always invoice us a little ahead of the game. Page 5. And I will say the last few pages, Cindy transitioned into Miranda Culver being the manager, which is all behavioral health services. So these are a lot of different placements and things. So page 5, everything's trending well. And page 6, same, trending well.
All right, do we need to have any discussions on any or contract reports, monitoring report? Hearing no discussion, we'll move on to approve our contracts and amendments. It should be in your folder as mail out number 2.
So the first group are all new contracts for 2020. So these would, most of them were needing to be initiated in October. And so I've got actually the contracts all prepared. They're waiting on Tracy's desk. Once everything gets approved, she'll sign and we'll send these off. But these are all new providers for 2020. And I don't know if you want to go through that. Most of them are Miranda.
So you'll see they are new providers for 2020, and then we requested for the majority of them also 2021 contracts on the second half of the page. Do you want me to go through? I can go through each contract and speak a little bit about each of them if you'd like.
Yeah, that would be fine, because I noticed down on the bottom, they're basically the same people that were approving for 2021, correct?
That's right.
Yeah.
So Brodalock Healthcare Systems is an adult family home that would work with our comprehensive community services program on relocating individuals out of higher levels of care or the state mental health hospital. Jessica Lineberger would work with us also as a psychotherapist, going into consumer homes or meeting with them remotely during COVID, doing therapy with consumers. She may also work with us providing prevention services, working with us in the local school districts to train districts in possibly the BATVIN method or prevention system for children. And the New Day Counseling is a psychotherapist just studying. She's been in the area a while. That's Sue Larson. She's studying her own business here, and we work with her, and a lot of consumers get services from her. And I think the last one is Children's Services with Jessica.
Yes, sorry. Positive Alternatives is a group home that we've identified for placement of one of the youth who was formerly in a treatment foster home, but their level of need exceeded the treatment foster home level, so we had to locate a new placement. This is a group home that we are doing both a 2020 contract as well as anticipating that this would be a placement provider into 2021 as well.
Okay, so do we need to approve the 2020 first?
Yes, I
Yes,
believe so.
yes.
So we're gonna do them all in one. So motion would be acceptable for all of the ones that were just listed here for 2020. Anybody willing to make that motion?
I make the motion, David Kaiser.
All right, Debbie Kaiser moves to approve all of our contracts for 2020. Is there a second? I will second it. Is there any discussion?
I would second Cindy.
Okay, we'll put Cindy down instead of myself. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed?
Aye.
Any
I
opposed?
think Cindy just has a delay.
Yep. Any opposed?
Aye.
All those in, okay, so motion carried. So we want to do the 2021 contracts.
And I believe this is all of the exact same contract providers.
Yes, just increased dollar amounts for what's anticipated either for the entire year or just a partial year. And Brodalock is the only one that will have to go to county board.
Because that's over 50,000 or whatever.
Yep.
Okay. So a motion would be appropriate to approve our 2021 contracts with these 4 or 5 people.
I make the motion to approve the 2021 contract.
All right, motion by Debbie Kaiser. Is there a second?
Second.
Seconded by Van.
And I have a question. With the top one where it goes to county board, it said it's for a CCS provider. Does that mean we get the reimbursement then for that at all?
Yes, that's correct.
Okay, just because it's going to county board, so.
All right, is there any other discussion on the motion that's on the floor? Hearing none, all those in favor signify by saying aye.
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 All those opposed, say nay. Motion carried. Personnel updates, agenda item number 11.
All right, so you do have this memo that I'm about to share in your iPad folders. Just as a reminder, we recently have now switched over the approval of new hires and resignations and personnel issues is now with the county administrator. So this is for the board's information. and it's not necessary for your approval. We have been able to fill our county position for substance abuse counselor with Kyla Luther. Kyla has been working with Health and Human Services in a leased position. So she applied for that county position and has been hired effective the 16th of November. We also were able to fill the vacant mental health therapist position that has been vacant for quite some time. Tricia Morzenti, am I saying that right, Angie? She will also start on the 16th of November and working, actually providing outpatient services, which will include substance abuse and mental health services. We have no probationary period completions to announce, and fortunately no disciplinary suspension or dismissal or termination information to announce. I'll scroll down and also share with you that sadly we have received a resignation notice from Christine Olson in our ADRC. Christine is the Information and Assistance Specialist. She is going on to school and found a position that she thinks will fit better with her needs to go to school and work. So Christine will be resigned as of the end of the month, November 30th. Also, as I mentioned, Kyla Luther was in a leased position. She's resigning that position to take the county position. I have no other personnel issues to point out to you, but I am scrolling down to the positions that are currently vacant in our county positions that are on the county books. So that includes the behavioral health. There's still one mental health therapist position that is vacant. Now there is the ADRC Information and Assistance Specialist that we're currently advertising for. We have several positions that are on hold, and they are on hold because we do not have budgeted revenue to cover the cost of them. Are there any questions for me on any of that?
All right, hearing no questions. Move on to agenda item number 12. Approve new positions included in the 2021 budget. Are these the leased positions that we're transferring over?
Yes, they are. So you might recall in the 2021 budget that we discussed transitioning our full-time leased staff into county positions. And so this is the process we would go to ask for approval for that. I'm just sharing the board handout to highlight what we have. So we have established that our budget, there's really a pretty cost neutral, if anything, a little bit of savings for the county by transitioning staff from leased positions into county positions. This is a little bit tricky because these staff have been with the agency, some of them for a few years. I think our ones with the least amount of time have been here at least 1 year. So figuring out how to do this in a fair, equitable way for those staff and still try to stay within the county policies for hiring new staff. So we're asking for a few things to try to accommodate how we can make this not be too much of a loss for bringing these staff in who've been Southwest Workforce Development Board employees. So the positions that we're talking about is first in the Administration and Building Operations Unit, the custodian position that is held by Dennis Drake. He's been with the county in a lease position since June of 2017. There is an existing custodian position description within the county pay plan, and so that's where he would transfer into if you approve it. So that's pay grade E, step 2, which is the step that new hires would transfer into. The other positions are all contained within the behavioral health unit. There would be a mental health therapist position that's currently held by Danielle Relke, who's been with the county since October of 2018. She would transfer into the pay grade K under the mental health therapist, step 2 again. There's a new position that we included in our budget. So this is not a transfer. This is actually a new position that would be adult protective services and crisis professional. This is comparable to the already adult protective services position. And so that's where this person would be placed on the pay plan. That's pay grade H. And step 2, we would then start advertising once we are able to get approvals for establishing this new position.
Was that Diane Cox's old position?
No, the APS position is currently held that Diane Cox retired from is held by Katie Pachkowski. So she is our adult protective services. So this is a brand new position that we included in our budget to try to meet that combination of adult protective services and crisis needs. So having a person have a kind of split duties between those two programs, because we've seen just a substantial need in both crisis and adult protective services. And then finally, we have had what we've called service facilitator positions for CCS program. And this would be a new position. There is not a comparable position within the county pay plan for this. We're calling it a mental health case manager, so it doesn't have to be isolated just to one particular program if the duties needed to be somehow used within multiple programs. We have 3 staff who are currently in positions, leased positions. So that's Faith Peckham, who's been with the county through the lease positions since November of 2017. Laura Radeska since July of 2019, and Corey Knabel since November of 2019. So these would be staff that we'd be asked to name into these positions. So the ask here is kind of unusual, but it's because we've had these staff, they are really a part of our team here at Health and Human Services. They've just been working in lease positions rather than county positions. So what we're asking is to name these staff who have been with the county for this period of time of anywhere from 1 to 3 years and put them into these positions. So that's a little bit unusual of an ask. We're also asking, because these are staff who have a history with us, that we forego the probationary period. They would start and be eligible for vacation. These are staff who currently are receiving a higher vacation benefit than what the county would be able to offer at the beginning. And so the ask is to award them with 2 weeks of vacation upon becoming county employees, and then they would follow the regular schedule for vacations. But that would give them close to what they currently have as leased employees. We're trying to not have them lose too much by transitioning them over to county positions, but it is a little bit of an unusual ask to do that. Did I miss anything, Angie or Miranda, as far as Okay. Do you have any questions about this?
I do, but it's really just a clarification because I think Carrie already asked this. But this was something that had been, like it says on here, within the budget. And it's because this winds up saving money. Was that kind of the background?
Well, I think there's a couple of reasons why we're asking to do this. When we have full-time staff who are leased and full-time staff who are county, it kind of creates this different status among our staff. And so it's better for if these are long-term positions, it's better for how we operate that they be county positions. It creates a little bit of a savings, but I don't want to overemphasize that. We pay a 7% administration fee whenever we lease a staff through Southwest Workforce Development Board. When you break down all of the expenses related to being a county position versus being a lease position, there is a little bit of savings, but it's not substantial, and that would not be the primary reason for doing this. Our budget will cover this whether these are county or leased positions, but we did build our budget with that in mind.
And is this increasing their hours or how?
No, these are all, I believe, all the current hours that they're working now is what they would be working if they were put into county positions. So these are 40-hour positions except for the custodian position. We originally planned for that to be a 40-hour position, but when we were asked to make cuts in our tax levy, we reduced it down to 35 hours, which is what that position currently is as a leased staff.
And this is not, I'm sorry if these are simple questions, but this is not replacing any current staff.
That's correct. These are staff who are currently working here, and they would be just changed to county positions. They would not be replacing or removing any other county staff from their positions. We would not be losing county staff.
Do you foresee any difficulty as far as this going through, what will it be, finance and personnel and then county board? Because I remember, was it a couple months ago, there was a position that had been approved and you were to name someone into the position and that ran into some issues. Is this going to fall under that same kind of category, or is it going to be different because they've been functioning in this?
That's a very good question. I do anticipate, because the finance committee has expressed that concern, that those questions may be raised. I think there's a different argument to make with this, because these are staff who have been long-term positions with us already. And that would certainly be the case I would make for that. But yeah, I'm not quite sure how that will be accepted by the Finance and Personnel Committee because of that previous concern.
But in this case, so just to help me understand here, in this case, they're already functioning in these job descriptions, correct? You're not changing like what they're doing. It's just the fact that they're now employees versus leased. That's exactly right. In the other case, weren't we creating a new position that did not?
Yes, in the other case I think that you're referring to is when we asked to create a supervisor position within the Child and Youth Services unit, and that we would eliminate one of those case manager positions and actually name one of those staff into that supervisor position.
Which would have been basically a change in the hierarchy as well.
That's correct.
Which this is not affecting those kinds of, we're not shuffling anybody or anything like that.
Yes, that's right. I will just to note that supervisor position is still tabled at the Finance and Personnel Committee, and I believe it may be taken up in December as well.
And what was the reason for going with the leased staff?
Well, historically, there's quite a history to that. Historically, when we have needed temporary staff, we have been able to get staff on board rather quickly by using a leasing agency. We currently use Southwest Workforce Development Board, but Lori Knapp Incorporated was also providing lease staff in the past. Also, when there wasn't a comparable kind of position within the county system and we needed staff, we have been able to do that. With the CCS program growing so quickly and needing to meet those needs, we were able to bring lease staff on board rather quickly. So there have been a lot of different reasons why we've done it. And I think, as in my history of being with Health and Human Services, I think there's always been a hope to have just one category of staff. There's probably room to use lease staff for LTE type positions, but if it's a long-term need, these should really be county employees.
A perfect example is what's going on right now with public health, that we have needed to add a number of positions, not full-time. They don't need to be county. They don't, it's limited term. Some are able to work 8 hours a week. Some are able to work 32 hours a week, which we're adding on right now, but they're limited term employees. Another thing, Tracy, was grant funded positions. So when we were grabbing a bunch of different grants for funding, some of those were only available funds for a year or two. So instead of creating a full county position and have to do unemployment and all of that, Southwest or LKI was our options. We'd still, just to note, we're still using Southwest. We still have a number of leased LTE part-timers. These are all the full-timers that we're trying to transition.
So
When
just,
you,
oh,
when you
sorry,
lease
go
an
ahead,
employee,
Chris.
go ahead.
No,
Go ahead,
you-
Ingrid.
I've already been talking. You go and then I'll.
Okay, two things. One is when you lease an employee from Southwest Tech, do you have different types of leases? Can you do it for days, weeks, months? Do you have to sign something? And the second question is, when you take one of their employees and assign them on as a permanent employee of yourself, do you have to pay any type of fee?
There's no fee that we pay to Southwest. If this were to happen, there won't be any kind of penalty. That's not part of our contract with them. The contract that we have with them is really per employee. They've been really good to work with in terms of, we need to try to hire someone to do like contact tracing, and even if we have some individuals in mind, they've been really accommodating. So there won't be any penalty to pay if we go forward with this, and they will end up ending those individuals, terminating their positions, and that'll be the end of it.
My question was going to be if, if there's some difficulties with, I guess, related to the other scenario that we had. There's a request, I don't know how they framed it the last time, but to advertise potentially. What do you think that would look like if you did that?
For these positions, if we were told that we needed to advertise for these positions, we certainly could do that. These staff who are currently in the lease positions would probably then have to apply. I would imagine that if they applied, they would be one of the top candidates because they've been doing the job, but they would not be guaranteed of being hired into those positions. And we're trying to protect those staff by asking for the appointment into the position, but certainly if we had to hire staff into the positions, then they would be faced with, first of all, losing their leased position and then risking whether or not they would be hired into the new county position.
I think I had asked something similar to this with the last one is I know some agencies would do like an internal application process first prior to advertising publicly. Would lease staff, if you did that, even just to, satisfy the requirement, if you did that, would lease staff fall under that internal application process?
Well, currently there is no application process like that in the county policies. I believe the county administrator is working on a policy, and I don't know if he will be bringing that forward next month, but I think that will be coming forward soon. So currently there wouldn't be anybody who could qualify for an internal application process. You're asking a really good question. If we had a policy that allowed for that, would lease staff qualify, or would they not qualify because they're not part of the county system?
Is there, if we ask the administrator to potentially look at that, what kind of problems would this cause, I guess, if we were delaying moving this forward until we had some information on that?
Well, I guess if this got delayed, those staff would stay in their leased positions. We need them. They're doing important work for us. So nothing would change in their positions in terms of the work that they're doing, just their status would remain leased. I think that essentially would be it. It kind of delays us moving forward with this plan, but beyond that, I don't think much changes.
Because you said either way, budget's going to cover whether they're leased or whether they're, and none of them are like they're not wanting to quit if they don't have a county employee status that you know of, correct?
I've not received any notice from staff. In fact, I think their biggest concern is what they would potentially lose, because they've been with the county or with this lease position working for the county for some time. And so they have accrued some benefits, and that's why we're looking to try to have them start with the 2 weeks of vacation, because they've already earned those kinds of benefits, and we don't want them to start back at zero. I think that's our bigger risk of losing staff when we make this transition, that they would lose benefits and feel that it's not worth it for them.
Right, which I think we could address at that point. But I guess my concern with this is I understand the reasoning for why we would just name them into the position. I do think it's different than what we talked about with the last time when this went through and didn't pass through. However, my concern is that it would be seen, or could potentially be seen, as setting a precedent for where you, even though it's not necessarily a new position, but you're having a position that you are then naming someone into, and the concerns that are brought up with that. So I guess I think that's potentially concerning, and maybe I would prefer to see, even if we had some sort of, like you mentioned, Clint, working on an internal application process, if that could maybe include them. I don't know. What do the other members think?
Do they receive benefits right now from the county as far as like health insurance and retirement?
Not through the county, but Southwest Workforce offers that. So they do receive health insurance, or they have it available to them. Whether or not they take it is up to them. I believe they also have some sort of an annuity program for retirement. So they have that access as well.
Yeah, they have access to all, not the same benefits, but a package plan through Southwest, yes. And I just wanted to note too, Tracy, you hit a good point too about the, this is probably our third or fourth attempt over the years to try to transition lease staff into county positions. But it's the first time we've really had a group of people that haven't been with Southwest super long. So we've always had someone that had been with them for 10 years and was going to lose a bunch of time or something like that. This group is, like Tracy said, is 1 to 3 years, and they're all full-time. Some accept benefits, some don't. So it's kind of this would be the opportune time to do this.
I get that. I'm afraid, I think that we might hit some roadblocks. I guess maybe even having, I don't know, Carrie, maybe you can add to this, or some of the rest of you, but maybe even having Clint look at that potential policy, or I guess, Carrie, you have more experience with this than I do. Do you think that this would hit problems in finance and personnel?
Yeah, that was my opinion. You were talking quite a bit on there, but which was good. I really enjoyed that. But I do think that there's going to be some problems at finance and personnel with this, especially with a couple supervisors that are pretty strict about stuff. And I get the point of this, and I see it, and I would favor doing this, but I don't know how it would go past. And I think somehow we can work it out and have good tactics to use to try to get this to happen, to go through. I see some benefit to that, but I think it'll be difficult. And I would be in favor of Clint countywide having some type of a policy written. We could do internal transfers, but I'm for it now, and I get it. I understand it. I don't think the other ones will.
I would like to share that I had a meeting with Clint earlier this week to talk a little bit about that internal transfer policy. So I know that he's working on it. I think he may be bringing it today to the department heads to talk about, because we're a large department and the smaller departments have kind of different needs. So I think he is trying to make sure that policy would be appropriate for the whole county. So I know that there's work being done on it, and I think that you're right to be concerned with how this might go through the Finance and Personnel Committee. I think like Angie said, certainly the timing is right with not having staff having significant losses if we do this, so we won't have resistance among our lease staff in making this transition. But I think that this potentially would be viewed not positively by some of the finance committee members.
I would be in favor of re-looking at this when we potentially have a policy that we could factor into this, if we could delay it by a month or two.
And I would suggest that when looking at the policy, if it is going to be presented to the department heads later today, making sure that the policy includes, when I think of internal transfer, I think of position to position, not status to a not like the least status to the permanent employee status, making sure that that verbiage is in that policy and that it includes that type of a transfer.
Tracy, on here. Do you think that there's going to be something established in a month or two as far as the policy?
I believe so. I think that I believe in the next month or two, it'll probably come forward to the Finance and Personnel Committee. Very possibly in December, but I couldn't say that for sure.
Well, I would make a motion to, I don't know if this is a motion, but I guess if it's a motion, Carrie, I'm not well versed on this, would be to delay it and look at it again after we have some more background with maybe in that policy.
That could be a motion.
Would it be to table it?
I guess, would that be tabling?
It would be to table this to another date if you want to give it. Otherwise, we'll just table for infinity if you wanted to. Otherwise, if you, in your motion, you want to table it till next week or December, then that's when you can come back on. Or if you just table it, tabling it is just tabling it till whenever.
Carrie, sometimes postponing is a better word than tabling.
That's
because
true.
It's easier to bring back a postponement than it is to bring back a tabled item.
And I guess, if you guys have other thoughts on that, I believe that this is going to cause concerns, questions of setting a precedent. So even if it's just to get some input from Clint or from someone from finance and personnel, but on a way that we could satisfy the concerns that they might have.
I couldn't agree more with you, Ms. Glassberger. You make some good points.
Although it's difficult to
So,
determine what
are
those
you on
concerns
your
might
motion?
be.
What was that, Cindy?
You know, it's one of those things that you do have to weigh because, I mean, we can guess at what concerns might be because of what's happened in the past with personnel and finance. And I only know from hearsay, I haven't personally experienced it, shall we say. But it's going to be hard to totally predict, you know, just what the concerns are until you actually do bring it before them, because there may be things that haven't been thought of with respect to even what the policy might contain. So I can see it both ways.
Carrie, you should get a second on this so you can put it into discussion.
Yeah.
Is your motion, Ingrid, to postpone?
Yeah, I guess that would be my motion. Yes, to postpone this.
All right, so Ingrid hasn't.
I second it.
So Ingrid has a motion on the floor to table this agenda item to a later time, and was seconded by Debbie Kaiser. Is there any further discussion?
I guess
Hearing no discussion, although.
Ingrid, were you wanting to table or postpone?
Go ahead.
Sorry, I think Supervisor Nelson mentioned that it's easier if we just postpone it. So I guess the wording should be postpone.
And you should really.
I agree with you, Cindy, on what you said. I do think, though, that I also personally have some concerns about the precedent that could be seen as being set by this, even though I think it is different than the prior one. So that would be another reason for me just wanting to postpone and look at that a little bit more.
Tracy, do you think that you could bring this up to finance and personnel of what your proposal and ask for input from them? That way it would get it out there, and then you would hear their concerns, and then at a later meeting then could bring it back fully with their support, knowing what they would want.
I would have to work with Clint on how to present it. Maybe it could be an agenda item just without asking for action, just asking for some discussion.
I think that would be a great idea.
Okay.
The only comment I would have is be careful with the internal transfer language. And I know you and Clint have been thinking about it, but
call it that.
yeah, because it reminds me of our union days. And for example, the custodian position, would that mean that the 2 custodians at the courthouse could post into this job? And then, you know, so then it ends up being a shakeup between a lot of departments. And I'm not sure if that's the intention at all.
Yeah.
Yeah, like, as I said, it's not really an internal transfer. It's just a change in their status.
So maybe that's the policy that needs to be looked at. Do we have a policy of being able to change someone's status? I mean, haven't we done that before? Do we have a policy for that?
Part-time.
Not for leased staff. I think we're the only department that has so many leased staff.
So maybe it's not, maybe the internal transfer thing, although I do think that one needs to be addressed at some point, but maybe that's not even what we should be looking at. Maybe it is just a change of status policy that would include lease staff. But again, I think that would be a good discussion to have at a finance and personnel meeting.
As you're talking about this, I guess what I would foresee doing is asking to put an item on the agenda for discussion and guidance on how to proceed, and just kind of explaining what we've included in our budget, kind of what our intention is, the rationale for it, and just seeking some identifying questions or concerns, and maybe some guidance on how they think that should be dealt with.
Yeah.
All right, I'm gonna call for a vote. All those in favor of postponement signify by saying aye.
I
Aye.
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 All opposed, or all those not in favor signify by saying nay. Okay, motion carries for postponement. So we'll move on to Johnson block up here. So we are on agenda item number 13. Approve the 2021 statute 8521 specialized transportation assistance grant. Roxanne, is she on here today?
I don't believe we have Roxanne with us today. This is a request to apply for the transportation assistance grant. We do this every year. The grant amount is $79,889. There is a 20% cash match, but that's something that we have budgeted and have done on a regular basis.
So we're looking for approval to apply for the 2021 transportation grant. And our match would be $15,000, $16,000. Is there a motion to approve this grant?
I'll move.
The motion that Debbie Kaiser.
All right, Debbie Kaiser moved and Ingrid Glassbrenner seconded for approving us to apply for a grant, a special transportation assistance grant. Is there any discussion?
Just note that it is on county board for next week as well.
Wonderful. All those in favor signify by saying aye.
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 All those opposed say nay. Motion carried. Number 14, approve the 2021 vehicle leases and memorandum of understanding.
Right, again, Roxanne isn't available to discuss this, but this is a recommendation to approve these 2020 leases with VARC and Schmidt Woodland Hills, and an MOU for Pine Valley for the vans or vehicles that they utilize through the county. I should note that this did get approved by the Transportation Coordinating Committee in October.
So a motion would be appropriate to approve this.
I would so move, Carrie.
Moved by Supervisor
I
Nelson,
would second,
seconded by Mrs. Chicker.
and I would second. This is Cindy.
All right, we got a motion by Supervisor Nelson and seconded by Mrs. Chicker. Is there any discussion? Hearing none, all those in favor signify by saying aye.
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 Opposed? Motion carried. Moving on to agenda item number 15, which would be an appointment of a committee representative to the coordinated services team. That would be an appointment from our HHS board to that committee, correct?
Yes, correct.
Who filled that position before? Linda, wasn't it Linda?
It was, yeah.
Could you remind us what exactly that committee does?
Sure. Our coordinated services teams within the agency, provide wraparound support services to children that need services from one or more areas of care. And so they work with our CCS, or Comprehensive Community Services teams that work with children, often in collaboration. The committee meets and reviews policies, and once in a while we'll make decisions related to new policies or changes, but overall provides oversight to the coordinated services teams and funding. And so Tracy talked earlier about how we just had our review of how we use that funding for coordinated services teams for children. The committee meets usually 4 times a year. It's been a little bit more challenging with COVID, to review what we've been doing. And then also that committee oversees our CCAP, or our community options programming for children, and how we're spending that funding throughout the calendar year.
Do we have a list in front of us right now of who is on our little subcommittees that we have?
I apologize, I didn't have that prepared, but I think I can get to it.
Dr. Barris and I are on the Mississippi Valley Committee. Who took my position on CCS?
I believe that's Van Nelson.
Van's on there. Are you on one, Ingrid?
Well, I'm on the transportation, but that's through a county board appointment. It wasn't related to.
Yeah. I think Cindy would be good. There we go.
These are all of the county committees. I'm gonna scroll, you can.
Well, and I'm thinking about that. I'm thinking about it mostly. Okay.
So the transportation committee that we're appointed to, Ingrid, you were appointed that because you are a Health and Human Services board member, correct?
I don't think so. Or was I? I don't know. It happened when I got appointed to county board. So when we had to like put ourselves on, when committee on committees assigned us to the various boards. So I didn't know how that fell out with Health and Human Services, if it was related to that or if it was because.
Yeah, because you were a county board member on HHS board. That's why we did that.
Okay, perfect.
There's a lot of those. There's a lot of those committees where we, like Hidden Valleys on Parks Commission. Usually it was supposed to be a Parks Commission member, but we didn't have one available to do that. So
now the CST team, it doesn't have to be a county board member, right? It can just be any of the Health and Human Services board members.
correct.
So,
Okay,
Yes.
so Cindy, did you say that you were interested in that?
Well, I'm thinking right now, my interest is piqued because I'm also a member of the Richland County Council on Family and Children's Commission, RCCFAC. I'm the treasurer there, and I've actually frequently been wondering just about the intersections between RCCFAC and HHS. And I know that Miranda's name comes up periodically and someone else's, but I would see a connection there. So I would say sure.
Great. Carrie, do we have to do a nomination process?
Yeah, or motion, or if anybody else has any interest, I guess put your name in if you want to be part of that. I'm not wanting to be per se.
I think Cindy should do it. Be great.
Okay, so I take that as a motion from Ingrid that she would have Cindy Chicker be on our CST committee. Is there a second?
Second.
Second.
So we got a motion by Mrs. Glassburner and seconded by Supervisor Nelson. Is there any further discussion? So all those that are in favor of Cindy being on our Coordinated Services Team Coordinating Committee signify by saying aye.
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 Opposed? Motion carried.
My husband doesn't get a vote, does he?
You could. All right, so we're at the end of our agenda. So a motion would be appropriate to adjourn.
I would move.
Supervisor Nelson moves for adjournment. Is there a second?
I second it, Deborah Kaiser.
Seconded by Debbie Kaiser. All those in favor signify by saying aye.
Aye.
Aye. Opposed?
Aye.
Motion carried. Thank you, everyone, for coming. See you next month.
Thank
Thank
you.
you.
Right.
Bye.
Yeah.
Thank
Aye.
you.